Yeah, I think using AI for integration into the point of care is, the important part. AI is of course important, but it's really that workflow and that integration that can ultimately lead to, cognitive load reduction. And I think that's an evolution I've seen in the discussion around burnout, specifically in radiology, is the, cognitive load and the context switching, that goes along with so much of the radiologist's job. So, Dr. Davis, I know you're very focused on the post-implementation process and, making sure that it's delivering the value. What are you thinking in terms of that cognitive load? Like how can you measure it? How are you thinking about approaching that with your, radiologists?
Yeah, I think it's quite difficult to directly measure cognitive load because it really is about how your radiologists are feeling on a certain day. And if they feel like we've implemented the types of tools that they actually ask for and actually need, that is a huge cognitive load decrease already. When it comes to generative AI tools like RadAI, the impressions tool, I think has done wonders in the market. And I think it's probably one of the only tools that you can definitively say, hey, this has some sort of impact on cognitive load. And we've heard our radiologists say that for complex reports we say many, many, many things within a report, and to be able to summarize that into a finding, it just feels better at the end of the day when I can review a finding and edit it rather than having to regurgitate what I just said within a finding section in some way. And so, it's very difficult for us to measure it, but the way that we try to do it is through surveys. And so we'll intermittently send out surveys every couple of years that will say, what do you think about these tools? Are they actually helping you? If they went away, would you be sad about it or would you be happy about it? And I think that that's the way that we start to understand if these tools are actually impactful for the radiologist or not.